I have a lot of patients who come to me and they'll say that their doctor tested their hormone levels and that their doctor said that their hormone levels were normal, okay? I want to talk for a minute about what that means and what normal means and how labs come up with normal lab values. The way a lab comes up with a normal range of lab values, and that is when you look at the lab report, you see what your number is, and then you see something called reference range, right? Which is typically, let's say for total testosterone, it's somewhere between 200, 250 nanograms per mil up to 1100, okay? Well, how does a lab come up with that number? Basically what a lab does is it takes a sampling of couple of thousand patients, and it takes that everybody's results. It takes a couple off the very top who are the outliers and a couple off the very bottom who are the outliers, and it takes everybody else, puts them on a bell curve, and calls that normal, okay? And so that's how labs come up with their normal lab ranges. Well, there's a couple of problems with that, right? I mean, if you think about who's going to the lab to have that value tested in the first place, typically people who are having their blood drawn at a lab are not the healthiest sample of people. And also, those are not necessarily the lab values that are associated with the best health outcomes, right? And so just because you're falling in the normal range just means that you're falling in the normal range of people who have had that test done at that particular lab, okay? And also, so if your doctor tells you you're normal, then you're kind of average for the people who've had their blood drawn at that lab, right? Well, if you're anything like me, I want to be optimal. I don't want to be normal. I don't want to be an average American. I want to be an optimal American, right? So what we do is we look at lab values that are associated with the best health outcomes, and that's what really optimizing hormones is about. It's not about leaving you in the normal range, it's about putting you in the optimal range, which is the range that's associated with the best health outcomes. What is the lab value that your doctor is actually looking at, okay? Testosterone is a perfect example on this one. Most people will go to their doctor and their doctor will look at their total testosterone level and they'll say that that's normal. Well, total testosterone is not representative of the testosterone that's actually biologically active in your body. There's total testosterone, and then which is the sum total of testosterone that is free, meaning floating around in your body, available to be used, and bound testosterone, which is testosterone that is bound to a hormone called sex hormone binding globulin. The number that your doctor's checking is your total testosterone. You're not really accurately getting a look at what testosterone is doing in your body. If you'd like more information on what I do, please visit our website at thebodywellusa.com.